So yes, hello guys, welcome to Utanocare. Today, nas kudautaura kuti BP inombobva kupi kana kuti hypertension inobva kupi. Right. So, you might actually not believe this, but the majority of hypertension, kana kuti majority yema BP, it's what's called essential hypertension. More than 90% yevanhu vane BP, there is no cause known kuti this hypertension is caused by this. It's just hypertension which happens for no known reason. Or should I say, currently, as the medical field stands, there is no clear answer. Why is it that some people, they just get hypertension? We don't know why. It just happens. And so, that hypertension, it has no known cause. Inongonzi essential hypertension. And there is no historical since Sagadaro. Get hypertension out of nowhere, not necessarily with some underlying disease, not going to go snack simple, not going to go to exercise. Everything in every sense might be fine, but still you'll get hypertension. So, what am I trying to drive it by saying this? I'm trying to say, don't be afraid if you ever come across the diagnosis of hypertension. Just know that sometimes it has nothing to do with your lifestyle. Maybe sometimes there's a genetic component. It's there. There's always a genetic component and an environmental component. But the majority of the time, it's just hypertension which comes because it's just there. It just happens. There's no known cause of this hypertension. So don't stress yourself whenever you go to a doctor, then you're told you have hypertension. Yeah, in some cases, there might be a cause. But every time, Panita, my hypertension cases are never determined causes. But this hypertension is because of this. It only makes up 10%. Some sources even say it's 5%. But the majority, which is to say more than 90% of my cases are hypertension. It's what's known as essential hypertension or primary hypertension, which is just hypertension with no known cause. And then there's a small percentage of hypertension in secondary hypertension. So it just means that this hypertension is coming about because of something else. So what are some of the things that can cause hypertension? Not necessarily it's essential hypertension. So itsvo dzako dzikakwara kana kuti ukaita chirwere cheitsvo. Itsvo is one of the organs in the body that is a function yekuregulate blood pressure yako. Saka itsvo dzako dzikafa dzinokwanisa kukonzeresa kuti uite hypertension. Then pane mamwe mahormones anogadzirwa nezvinhu zvakawandisa. Mahormones anogadzirwa ma-adrenal glands. They also play a role in the control of blood pressure. Saka if you can have a tumor organs iwayo, unokwanisa kungoita just problems, and you can have any mishap hormones that are supposed to control your hypertension. You can end up with hypertension, and in those circumstances, it means that you don't necessarily have to take treatment in hypertension. You might do whilst you investigate is there an underlying cause of your hypertension, but then once the underlying cause is corrected, you don't have to take medication because hypertension. Your hypertension was being caused by something else. But in the majority of cases, I'll say it again, the hypertension has no known cause. So now I'm coming back to the issue of is it possible to hypertension or mwanamdiki? Yes, and you should know this again. Hypertension kuvanhu vadiki, hypertension kuvanhu vakura. Most of the times again, hypertension kuvanhu vadiki, it has no known cause. Most of the hypertension again kuvanhu vakuru, it has no known cause. But usually, kukaita hypertension uri mwana mudiki, we try to look for a secondary cause. Just to make sure you don't have any other underlying condition that may be causing the hypertension. But in the majority of cases, don't get depressed if you find out kuti pashaikwa cause the hypertension is just essential. It happens. But they try to screen for the cause of the hypertension in young people because We're just saying we don't want to leave you for the rest of life uchirarama any underlying condition. But if it was somebody are older already, it matters, but maybe not so much than if it was somebody who is still in their youth. So the take-home message for today, you just know that with hypertension, in most of the times, it just happens. It has no known cause, and there's nothing you can do about it. If you enjoyed this video, make sure to subscribe, to comment, to leave a like, and share with somebody who might need this. And of course, if you have any questions, leave them in the comment section. I'll be happy to answer your questions. And thank you. I'll see you in the next video. And then in the next video, I'm going to talk about some of the things that we do lifestyle-wise that might cause hypertension, things that you might need to check to reduce or to think about so that we are sure that you reduce your risk of getting hypertension. Thank you.